doctor. My son is 12 years old and he has crowded teeth and seemingly small jaw. Our dentist has recommended an appliance to help the jaw grow. However, they mentioned that while growth can be initiated, full potential growth cannot be achieved. I don't quite understand why full growth potential cannot be reached. Should I go ahead with the appliance? What are the disadvantages of not using it?
So what they're talking about is when the jaw, when the boys or the girls, when they grow, when the kids grow, so there is something we call it as what we call it as a suture. So right here. So if you guys can see the jawbone, there is what we call it as in the midline. So the jaw kind of like in two parts, our right side of the face and then the left side of the face. So whenever the jaw is growing and the suture is there in between, and it fuses after at a certain age. So when they are in the growing age, and that's one of the reasons why they say, hey, don't watch the baby's heads, because it's wide open right here before the skull completely closes. So the same way, the teeth when or the jawbone before they completely fuse, if you have crowding, so if you are able to what we call it as an expansion, so if you are able to expand, then the teeth will have room to come through. So the advantage of using the appliance, the one that you are being recommended, is to when the jawbone expands, it's going to allow for the teeth to come through, so you can avoid some teeth to be removed for the braces purposes later on. I cannot think of any kind of a disadvantage from really using that, other than, well, you're going to have maybe a longer period of time, because if you are going to do the expansion actually before you get the braces on, so you're going to have another period of time. You're going to have these expanders on the kid for maybe another like a couple of years or a year, depending on how much of expansion need to be achieved.